All right. Well, welcome everyone. I'm going to go ahead and get started. Thank you everyone for joining us tonight. I'm Kaya, by the way. I'm one of the residents from Rush Emergency Medicine. Thank you again everyone for joining us tonight. We're going to be talking about our selection process and the application process for our program, some of our diversity efforts and leadership and whatnot. I know there have been a lot of programs going on and a lot of webinars, so I really do appreciate everyone coming out to learn a little bit more about our program and hanging out with us tonight. I just kind of want to go ahead and introduce a few of our speakers that we have with us. So whoever's on this call, any of the faculty, residents, we can go ahead, just unmute yourselves, introduce yourselves, and then we'll get right started.
All right, well, welcome everybody. My name is Braden Hexum. I'm the residency program director. I want to welcome you all. This is, we've done a number of these now, and you're still here with us, following along for the ride. I love it. This is an exciting one because we've been sharing our program with you and giving you some insights into what our program is all about. But this is where we actually get to tell you a bit about what we're looking for in you. And so I'm really excited for this discussion. And I look forward to talking with you guys about more about what we're looking for.
All right, who else is on?
I can go, I guess. I'm Carolyn Clayton. I'm the clerkship director and one of the core faculty members. So welcome. I see some familiar faces as well. So welcome.
Hi guys, I'm Yanina Puram-Shamtov. I am Vice Chair of Emergency Department, and I always would like to welcome you to this program.
I'm Matthew Coons. I'm also one of the core faculty members, and it's great to see you all tonight.
Hi, my name is Vinu. I'm one of the core faculty as well, and I'm happy to see y'all. And hopefully we'll be able to talk more about what you guys are interested in looking into our program and get to know you guys more. Thank you.
Hi, I'm
Trevor.
Go ahead, Trevor.
Hi, I'm Trevor Landis. I'm one of the PGY3s. Nice to meet you guys.
And I'm Lauren. I'm one of the PGY3s.
All right, so we're gonna go ahead and get started right away. I know everyone is really interested in about how this application cycle is very different, what it is that we'll be doing in terms of prospective applicants and how we'll be reviewing applications. So that question is gonna go straight to our program director, Dr. Hexum, if you don't mind touching a little bit about this year's application cycle, what our process looks like in reviewing applications, and maybe a little bit about what we're interested in and what type of applicant we're looking for.
Yeah, absolutely. I know that many of you probably have a lot of anxieties about applying. That's one of the reasons that we're doing this, to give you some insight into the program and get you to meet as many people as possible and get all the information that you need in order to make your decisions. In terms of what's different, I'm actually rather excited to see what happens in the next couple of weeks. We're going to get applications from people who, may not have considered traveling to Chicago, but have had some curiosity in what Chicago might have to bring in terms of residency training. You have a bit of more freedom actually in this process by being able to look very widely at different programs. And so we're going to be looking at, aspects of the application that are going to be maybe a little bit different from the past. Since I can't get to meet you, face to face or really get a sense of what you're all about, I'm really going to be looking at things like your personal statement, the activities that you have been involved with. Some of these things are very similar to past applications, application seasons. So I really want to know, not so much like what is great about emergency medicine, but what is really unique about you that will make you a good fit with us. If you look at our residents and what they have done, both in residency and now as recent graduates, we really value leadership. We want to see that you have been involved in taking bold initiatives and founding new groups, in making change in programs at your medical school or in your community. I think that our residents are very community focused. We have seen a lot of growth in our street medicine program, in our social and community health programs, and international emergency medicine. We've got some faculty and residents here who can talk about that. And so those unique qualities are what really make you stand out in an application when we're reviewing. So I want to know, how are you unique? How are you going to fit in with our population and our residents and faculty? And are you going to be an outstanding professional physician?
I know, sorry, Dr. Gore also didn't get to introduce herself. I apologize. She's on as well tonight. Dr. Gore, if you have any input or any advice on that.
Here,
Well, thanks, Dr. Gore.
so that so you can't hear just him talking. I honestly think that rate and cover kind of the biggest things that really are what I'm looking for as well. I think we're all on the same page from a leadership perspective. I really like seeing people who have that some sort of unique aspect, that something interesting about what they're doing with their interests, and that doesn't necessarily have to include like clinical work in the emergency department. You know, we have so many different people here that have so many niches, and I love hearing the stories about like your unique backgrounds and what you've done in the past.
Thank you. Maybe some of our residents can kind of talk about what they look for in their co-residents and who, you know, what type of personality fits well within our own program. Maybe Lauren and Trevor, if you guys want to say a little.
Yeah, so basically, you know, usually we can meet you the night before or during the day of with the tour that we usually give. And I'm just kind of looking for somebody that is, you know, it, like Kasha said, like has these interests, is like easy to talk to. We're just trying to look for another family member, basically, that we kind of established here with our residency group already. You know, I think it's just trying to find somebody that like meshes well with us. And I think that that's something you guys need to look for too. If you get an interview, that's great. Like they already looked at you academically wise, so just try to find somebody that you think you fit in really well, because that's exactly what we're looking for.
Thank you, Lauren. One of the questions we had submitted both in our chat, and I had a list of questions already submitted prior to tonight. A lot of people are wondering about the SLOWE, the eSLOWE, specifically, you know, what is our program doing in terms of how many SLOWEs, eSLOWEs? I know only one has been recommended. And then in our chat, we have a specific question for someone who's applying as a civilian who practices a Navy doc without a SLOWE. What will the program do, and will they still evaluate the application?
Yeah, it's a great question because there's a lot of anxiety about rotations and letters. I think we as a program have always appreciated the slow letters, but we've never been bound to them. And part of that is because we recognize that people have unique circumstances. We've taken residents in the past who have had completely different routes to medicine and may have been doing other things. We've had those who have done other GME residency programs, psychiatry, internal medicine. It's really hard to get a slow letter when you just don't have the ability to do that. You know, and Dr. Parker, you said, you know, it's really hard when you're in a situation in which you're not a student anymore and you're no longer able to get those. CORD has adapted an OSLO, which is really interesting that now there's an opportunity for your letter writers to write a variation of a standard letter of evaluation, but they don't have to be part of the traditional EM rotation. And so that's really nice, but it's also not something that we're totally bound to. So there is no real requirement for me in terms of what, you know, letters you get and what they look like. You know, I'd love to see a slow, but I'm really going to be more interested in your experiences and what makes you unique. If you look at, there was several articles that CORD has put out over time that looked at what program directors look at when they look at applications. And it used to, and they said, you know, the number one was the slow. Well, that's gone, you know, and if that's not really available to me, I'm not going to put all of our decision making based on one letter. So we're going to use your whole application to kind of think about, are you going to be a good fit for our program?
All right, thank you, Dr. Hexam. A few other questions about kind of like the selection process in terms of IMGs, DOs, people who are not from Chicago and are interested in coming to a Chicago program. Anyone who's involved in like the interview process and even the application review process, if you guys want to kind of give them a few tips about what they can expect and how to calm their fears about, hey, you are still a very great candidate. Anyone want to start with that?
Well, maybe one example to give you guys in terms of DOs. Our chairman is a DO, and we actually are proud of his work. So DO is never an issue. In terms of IMGs, foreign grads, we have had a few who graduated from accredited programs in the Caribbean. And did really well and have placed into a very academic, one class academic program in Cleveland. So definitely not avert to that.
I'd also like to add that I think one of the big strengths about our program is that we really love diversity. Diversity of thought is one of those things, and diversity of experience. So, so I think by having that as a broad type of theme that we really like to promote in our program, that's something that you guys should be aware of. You're all welcome here. And I've felt that way from the moment I started. So I really do think that it's something that we're hoping to promote. And we do have a lot of programs that we're also trying to fill that, sometimes that void that we see in the world. So we've started to develop a diversity, inclusion, racial equity track. This is part of the education that we're providing to our residents, and even our faculty and some of our nurses are also taking part in this, like this basic Canvas website where we all kind of take part in the education of improving ourselves in terms of implicit bias training and trying to create and promote a safe culture at Rush. And then also we do have a social and international emergency medicine track. So if that's more of an optional track if you're interested as a resident to do either local work and improving programs available to local residents in Chicago as a whole, or if you would like to do more in terms of international work. So those are some other branches you could take if you have a specific focus or interest in that.
Awesome, thank you, Dr. D and Dr. Purim. And then just kind of finishing up a little bit more about our specific selection process and application process. I got quite a few questions about what type of resident in terms of academically are we looking for? Are there any specific score cutoffs? Are there any other academic cutoffs that we're looking at in the application?
Yeah, we've never set a a cutoff. We get that question probably more frequently than anything else in the residency email inbox. Is what is your step 1? What is your step 2 cutoff? That's never been an issue for us. Obviously, we want you to be able to take on the challenges of 3 years of residency programming and be able to have the academic background to be successful, right? We want you to succeed, and this is a hard, EM residency is hard, so we do look for people who have excelled academically. But I also recognize that the USMLE is not a predictor necessarily of are you going to be a great emergency physician. It's just one piece in the puzzle. So if you have had setbacks, and it is a standardized testing kind of thing, that doesn't eliminate you from being a candidate with us. I want to see, well, how else have you excelled academically? What other areas have you really shown leadership, and are you going to be a great physician? What do your letters say about you? What does your dean's letter have to say about you? So we have worked with residents who have had challenges in those areas. And one of the ways in which we are very conscious about the way that we provide mentorship to make sure that we have folks checking in on you every step of the way both peers and faculty, so that we can identify people who are struggling, early on in residency and get them the support that they need. Rush is very committed to this. I get great support from our GME office to be able to mentor residents who are struggling, and so that's it's not a deal breaker for us. But I do want to see, how else have you been an excellent academic candidate?
Yeah, and kind of talking about setbacks and hardships you have faced, I myself am a foreign medical graduate. I went to St. George's University. I did great on step 1, didn't do that well on step 2. So, as someone who comes as a non-traditional applicant, as an IMG, didn't have the strongest UMLA scores, I really do feel well supported by everyone at Rush. I feel very lucky that I was given the opportunity to come to Rush and just kind of thrive as within my own little bubble and outside of my bubble, and taking on activities and leadership positions and whatnot to kind of really make me into the physician that I am today. So, I think even if you have had setbacks, a lot of it is how did you bounce back from that, and what are you doing to improve yourself? And I think, especially when it comes to scores and the academic side, I think what we're really interested in is how teachable are you? And I think that was one of the best pieces of advice I got. Like, you may not be the smartest cookie, but as long as you're teachable, willing to put in the effort, I think that says a lot about your character and the type of person you are. So, anyone who's facing setbacks is a little fearful and hesitant about that, I think, we've really gone above and beyond to kind of help support all of our residents. So that's my little spiel on that. So let's talk a little bit about our diversity efforts. Obviously, I know diversity, inclusion, anti-racism, all of these topics are really current hot topics in medicine, and we've really been focusing a lot on that recently, although we've known these are issues within healthcare for so long. I'm so glad that Dr. D as well as Dr. Perm are on the call with us tonight. If both of you can maybe talk a little bit about what our own emergency department has been doing in terms of diversity, equity, inclusion, anti-racism, that would be awesome.
Well, I think it's actually, I would like Vinu to touch base on that, because she is a cheerleader and a champion of this area in our department, who essentially, with support of other faculty, has created an extraordinary curriculum that they're all participating. Besides that, we also working on creating a committee that solely looks at issues concerning to inequities and social injustice. They have lots of programs in the department, and linking with institutions are looking at social determinants of health, which is very important for our patients, including homeless patient population. They're participating in a lot of outreach programs, and I'll let other people who are involved in it, such as night ministry, etc., in the community. So a lot of different things are going on, and there's still more work. I'm personally involved in more women leadership platform in the institution, to looking at inequities in faculty pay depending on your gender and rank. And so there are lots of different programs, and I think Vinu should really talk a little bit more about our DIA program as well.
Yes, so we basically do have this DIA program. It's spurred on after the terrible killings of Ahmaud Arbery and George Floyd. And right after that kind of happened, our entire department met up as a Zoom call. COVID has kind of made everything a little difficult when it comes to discussing these things as a group. But the residents, the attendings, we all kind of mourned. And we kind of looked at our past and we said, this is a big problem, not just personally, because it's always painful to see any human be affected and hurt that way, and all the people who were connected to those individuals, but also the humanity aspect and being a physician and knowing that there are so many issues with health equity just within our community, and that we might be part of the problem inherently without really realizing it. And so that was a really important discussion that we all had, and it made us decide that this is something we want to take on as a priority within our department. And so a group of different attendings kind of came together and said, let's make some form of an educational track so we can incorporate that for our residents. It was actually the residents who said, we want this, we miss this, and we need this in our education. And so we had a couple of resident representatives that they played a huge role, including Kea and a bunch of other people who actually graduated that said, hey, this is something we need to change. And so that is what helped us develop what we call the DIRE program. It's diversity, inclusion, and racial equity. And basically incorporates 15 and 20-minute reads, watches on YouTube, TED Talks, based on specific things that could hopefully help us take a different look and maybe walk in a different set of shoes in life. And for the first year, it's mainly the Black experience in America. We're going to then take the second year as Latinx and gender bias, as well as include LGBTQ bias. And the third year of your residency will incorporate more of the cultural nuances and competencies, as well as cultural humility. So we're kind of incorporating all this in the 3-year program, along with the other didactics you'll be learning as you proceed through your training. And that is something that we're also looking at residents to help us form. So it's something that's dynamic, and it's including a lot of different folks so that we can make sure that this is a well-rounded experience for everybody. It is a platform that's online, so it is self-paced, and it allows folks not just as residents, but also attendings, nurses, technicians, anybody who's in the ED, it's available to, so they can all take part in these discussions. So it's a discussion forum, but also some of these are quizzes you can take. And it's not a huge time commitment. From the resident standpoint, I'd love to hear a little bit of how you guys feel this has been going on for you guys as well. And then in terms of the social, so we also have a social global emergency medicine track. Social emergency medicine is basically looking at the social determinants of health. It's looking at homelessness, looking at food security, looking at joblessness, poverty, the whole issues with all of these issues that play a role in even health access and health equity. And so we do focus on that as a whole as an optional track. So if you guys are interested in taking part in that, we have a group of residents who are doing that track as well. And then at the end and during graduation, we do award a final certificate to those who took part, and then a final award to someone, any resident who has taken on a big leap into this and has formulated some kind of project or some kind of programming that has improved the situation for folks who live in Chicago, so or in around the world. We mainly work in Dominican Republic as well. So that's kind of what we do in a nutshell. Any questions about that?
Kind of to answer your question about how the residents are, going along with the DIRE, I think it's fantastic. I really do think as a resident, I don't even really remember much in med school. A lot of education about, taking care of diverse patient populations, racism in healthcare, besides like the major topics of Tuskegee and all of those, things that we do learn about. But I think it's a fantastic opportunity as residents, especially because we take care of such a diverse population in our emergency department, not just our own emergency department, even at the sites that we rotate at. So I think this is really a fantastic tool for us. And again, like Dr. DeSayanke said, it's not a large time commitment. A lot of it is dynamic. So watching these TED Talks, I love TED Talks. So watching these videos and reading these really eye-opening articles and op-eds and just the educational component of it, I think has been pretty fantastic. And just to kind of let you guys know, I also am on the board for the House Staff Diversity and Equity Inclusion Committee. And, based off of our own ED curriculum, they're actually interested in making it this entire GME wide program. So we're hopefully going to make this a whole thing that happens at Rush, and it's not just specific to our residency program. So I'm really proud of our emergency department for kind of leading this and being able to kind of contribute to how we can change our culture at Rush overall. I don't know, Trevor and Lauren, if you guys have any comments on that, or maybe if you guys can talk about even our protected Windy City EM conference that we had today and kind of how that ties in, that would be awesome.
Well, the DIRE curriculum has really helped me identify gaps in my own knowledge I didn't even realize I was there. And so it's helped me become a better clinician. And then something that I actually didn't realize that would occur with this curriculum was that I got to learn more about my co-residents and attendings, because we're all pretty diverse and some of the discussions are pretty interactive and pretty personal for as much as you want to share. So I think the benefit is like learning about one, the diverse community that we serve, but also learning about the community that we work with within the ER has been beneficial for me.
I think it's also really important to note that it's not just the attendings and the residents that are contributing and participating in this curriculum. We have opened it up to anyone in our department to participate in, and so we've had nurses and techs that are really involved in going through this curriculum, leaving their comments, and I found that really interesting because I've also learned more about the people in our department outside of our own little circle.
Yeah, I'm glad you brought that up, Kasia, because I wanted to talk a little bit about it too. You know, that while the residents, I think, and faculty, maybe the curriculum is great, it's just a piece of, you know, this larger movement that's going on within the institution. I've loved that we as a department have been involved in really engaging everybody who, you know, spends their day-to-day in the emergency department in the process, right? So, you know, some of our faculty, I know Dr. Clayton was here, who have been going around to, you know, our techs, our nurses, our housekeeping staff, and recognizing that, like, we all are part of the healthcare team, and we need to understand, you know, that our, you know, the demographics of each of these groups, you know, are skewed for so many different reasons, right? And that there are individuals, you know, among all of those groups in our department that have experienced, you know, overt and you know, covert racism and pain within their communities, and Chicago is, you know, is a place where this happens, and we feel it every day, especially in the patients that come into the emergency department. So to be part of a group that's really trying to engage all of those demographics and groups within the department is great, because we're finally really, I think, breaking down some silos, right? I think even just in the day-to-day, it's easy to forget that, you know, the nurse working with you may have a very different experience of racism than I do, obviously. So it's been great.
And this is, I don't know if you guys can't see me, this is Scott Heinrich. I'm one of the faculty. I'm just in a car, so no video. But Kaya won't toot her own horn, but I'm happy to do it for her. But ISEP, which is the Illinois College of Emergency Physicians, is actually producing a webinar series on structural racism and social justice. And Kaya is actually moderating one of the sessions, actually coming up, I think, next week. And so it's just great to see the residents getting involved at a statewide kind of board level and very impressively doing it. So it's just more things that the residents are getting involved in as well, and leadership roles in that vein.
Yeah, and I think all of our women faculty on tonight, Dr. Desayanke, Dr. Gore, Dr. Permin, Dr. Clayton, we all sit on that social community EM committee on ISEP, and they've all helped about this, which I think is fantastic. There's a question here in our chat. How have these educational opportunities changed the way we actually interact with our patients? And I'm not sure if anyone has a personal anecdote that they'd like to share with, to see kind of, you know, after going through this dire curriculum as much as we have, if you guys have seen any changes you've made within your own personal practice, that would be awesome. I know for one, especially going through some of the education that we do on our homelessness population, kind of just being a little bit more proactive and a little bit more aware of the situation. And when I'm dealing with patients, and now I'm starting to ask not just, you know, patients who externally look like they're homeless, right? We kind of have this picture in our head, oh, this is a homeless person, this is what they look like, but kind of breaking down those barriers and kind of asking all of my patients, hey, what's your home situation like? Where are you staying tonight? What's the plan for what you go home after today? And I think that really helped kind of determine, helped me determine what other support and services I can kind of provide for my patients, whether it's hooking them up with social work, with any other resources that they may need out in the community. So I think that's been a really big, important thing that I've noticed in my own practice, in my patients that I take care of.
So I'm going to give you a little bit of my own personal evolution. As we were training, and I'm trained at Cook County Hospital, so it's a very similar community that I'm taking care of presently. The way we were addressing and the way we were taking care of patients is primarily looking at the disease process rather than the actual patient. And with time, what we've learned is there's a story behind each patient. As with the years, every time you see patients, so frequent flyer, patient who comes in all the time. And so on the third time, it's pretty much triggers off to ask what is happening at home, what is happening in your personal life that triggers you coming into emergency department so often. And it's not necessarily disease process. It's usually some other social determinants, or as healthcare necessarily not the problem, but there may be some other situation that triggers. That actually started probably maybe last 2-3 years, where I started actually looking at what is the trigger rather than what can I fix.
I think some of the stuff that has changed too is my wording with certain questions. So, you know, for one instance, like instead of saying like, do you have sex with female or men? Like, what's your sexual preference? Stuff like that. So that things are more inclusive and not just kind of giving people answers that are only A or B. It's opening up kind of the dialogue there to try to be more open with anybody. And I think too, another thing, especially with everything going on with COVID, with all this stuff going on, I kind of just sit down and I go, so also like, is anything else going on? Like, how are you doing? And most people are like, I'm fine, but thank you for asking. But it does open this up, and it has allowed me to find people that are struggling with a lot of like mental health stuff. So I try to set them up with resources like that. Or, you know, like they are homeless, they just lost their job. And then I try to get social work to come into the room and try to help them for a place to stay. And I think that just, you know, in the emergency department, we're fast, we're really, really fast. And we try to be really, really fast. But just kind of slowing down for at least like 30 seconds in a patient room and kind of doing this training has kind of taught me that and tried to show me to kind of like open up my dialogue and what to actually, to try to just have an actual more connection with the patient.
I'm gonna echo everybody here, but I think part of the change or shift in how we have come to approach patients also really has to do with how proactive Rush as a whole has been at really putting this at the forefront of their mission, and providing us with the resources that we can help patients. So being able to have a patient care navigator in the ER, and that I can call or message James and say, hey, I really need this patient to be seen by a cardiologist in the next week. Can you help facilitate that? Really, it's like just helped me as a provider feel like I'm doing more for my patients. And so this holistic approach, I feel like has really been spawned by the fact that at Rush overall, it's been a mission.
Thank you guys. And kind of going off of a little bit of what Lauren touched off on, you know, asking about sexual orientation. I have a bunch of questions here that people have submitted about what type of LGBTQ healthcare initiatives do we have, and what do we do as a program, and how do we support our LGBTQ colleagues? So if anyone wants to kind of shine a little light on that and kind of just answer any of these questions, that would be awesome.
So I don't know if you guys are aware, but Rush has got actually gender affirming care services, and we just received an award in this area that we provide the best care for our LGBTQ and plus community. We are certainly very sensitive in the area and very welcoming. Rush has been participant and leader in the all of the organized programs as they're related to LGBTQ community plus. And so mentorship programs are very important in the area as well. It is a sensitive and difficult conversation, obviously. And I think it is an amazingly welcoming environment overall.
I like to say from a resident perspective, because I'm part of the community, I think it's very welcoming. It's never been an issue. I'm out to all my colleagues and my attendings, and everyone's been really supportive. So, you know, my experience has been overall really good. And I think we integrate it well into our education. We've had a couple SIM cases where, you know, how do we communicate with this community? And we've had cases where, you know, there's certain medical issues that present that are specific to this community. And so I think we get enough exposure. I mean, obviously there's always room for more, but you know, I think the residency has done a good job about being very open and welcoming on a personal level, and then within our clinical training too. So it's been a good experience.
Yeah, I agree with what Trevor said. I think the emergency medicine residency program, as well as the medical school itself, has been far above and beyond anything that I received when I was training as a resident or a medical student in terms of LGBT plus healthcare issues and other issues associated with medical practice. So I've been very, very impressed.
You know, this is a group that Rush has really been advocating for years. You know, I remember coming as an applicant, you know, to get a job here at Rush, and that being something that I remember from that discussion. You know, Rush has been recognized as being a leader in healthcare equality, you know, by the Human Rights Campaign. There are numerous recognitions that Rush has had, and you know, with the coalescing of essentially a group of physicians at Rush who are dedicated to the care of LGBTQ patients. You know, this is something that I think if you are not comfortable with, if you have not had a lot of exposure to this is a great place to come train, because we will teach you how to actually be able to communicate, interact, affirm people who are very different from maybe the experiences that you had growing up or in your training up to this point. So, you know, from the other side of things, I've learned a lot as a clinician, and I think it's a great place to really get that experience.
It's also something that may seem small to some, but I actually appreciate that our Epic actually has pronouns listed for our patients, which has helped a lot when you're going into a room and you can actually go in there before going in and know the pronouns to use. And I think it's something that it seems small, but it really is a institutional focus on our patients that I actually appreciate. Even though it's something that everyone should be doing, but I don't think they are, and I really appreciate that we do it.
And I do want to add, we are actually going to host a couple of training sessions for faculty residents in trauma-informed care, which I feel like the LGBTQ community has been unfortunately a big victim of that. So this is going to also play a role in how we are able to improve our care of that specific community, but also other folks in other communities who may have been victims or survivors of that type of experience in human trafficking, especially, and trauma-informed care.
So we do have a question in the chat, and maybe Dr. Perm can kind of shed a little bit light on this. Are there any protocols set in place for any residents or any staff, anyone working in the emergency department or Rush that may face patient discrimination? I know there was a recent policy that we had put out. If you can let us know a little bit about that.
Yeah, I was going to say, Kaya, that's just very timely question for us, because we did just actually enact a policy. We, as a department, as an institution, do not tolerate any type of untoward behavior towards the same way as we don't tolerate this kind of behavior towards our patients. We don't tolerate that type of behavior from the patients or visitors towards our staff or staff. So we truly have a policy that directly addresses this point, where we at least at first attempt to work with the patient and visitors to redirect towards respectful and meaningful conversations with us. And if we do not, unable to achieve such a amicable environment that is safe for ourselves, our other patients, our staff, then we actually escort that type of patient or visitor out of the premises. Now, there's always EMTALA rule, and so we do have to provide care, medical care, to any patient that walks in. So it is a bit of a sensitive area. Any type of stabilizing measures, whether patient shows any kind of disrespectful behavior towards us, if patient is crashing, obviously we have to provide care for the patient first. However, if patient is stabilized and they continue to show this type of disrespectful behavior towards us, staff, other patients, we do not tolerate that as a department. And that's because we have seen quite a bit of escalation of this type of behavior in the environment and the community. And just like we want to respect our patients and provide respectful care for our patients, we expect the same in return. So I anticipate you guys heard this is a trend that this has been going on around the country, academic institutions, community hospitals, etc. Mayo Clinic has been leading in this effort. And so Rush has actually enacted very similar type of policy that has been published and has been validated. And so excellent questions. I really enjoy it, but that just means that the same way as we expect respect, we also give respect. So the environment goes both ways.
I would just add, I think this was a huge win for us that we were able to do this for our own people, for our own faculty, staff. It was a big issue, and I think until recently, we weren't, maybe all of us, aware of what a big issue it was. And what Dr. Piram said is exactly right. This protocol is in place. And at the end of it, in terms of first you're dealing with the patient and dealing with the situation, and then the next part of the policy is that there is a debriefing period episode that you will do with your team. And then a safety event is written up so that we're kind of keeping track of these events. We're kind of going to develop some best practices about ways that we can handle this in the future. And so that when that patient comes back, we're all aware that this was an issue. Hopefully it won't be an issue on the second visit. But it's a way that we're kind of keeping track of that information. And so I think there was a question earlier about whether all of the DIRE curriculum is changing how we're treating our patients. And it is to an extent, but it's also kind of changing a little bit how we're treating ourselves and each other, and how we're feeling empowered to do things that are the right things to do. So I think we've been moving in the right direction, and I think we're just moving in the right direction a little bit faster and with a little bit more purpose.
Yeah, and I think on the resident side, we are also trying to develop like resident listening hours, and I think kind of all throughout the emergency department, some listening hours to kind of talk about our experiences that we as providers, as people who work in the emergency department, have faced with racism and discrimination, kind of making a safe environment to kind of just talk about these issues and what we can do to kind of help support each other as well. And I think, these opportunities have been fantastic, and I hope we can just continue to learn off of them and build off of them. And kind of I just wanted to finish off before we just kind of open up to any more questions is about women in leadership. How is it that our program is supporting women, and how do we empower female physicians and anyone else in the healthcare who is a woman? How do we empower them? I know we have amazing, amazing women faculty joining us tonight, and we even have one of our chief residents, Dr. Wirfs, tonight. So, and a lot of support from our PDs, and everyone in the ED. So if anyone wants to talk about that, please go ahead.
I can. I feel like a lot of it is a cultural thing. I think in our department, the fact that we have like 50% female faculty is a huge thing. I mean, like that's not a thing that's everywhere. And I think that having that kind of number and having a lot of women that are doing a lot of things within the institution, I can name so many people that are doing so many wonderful things. We just had actually an email today about like this initiative that got started because of one of our physicians, or actually two of our physicians, work on a committee within the hospital. And the wonderful thing to see was that like there was one email, and then there was another email that was like, "Hey y'all, did you know that was Mita?" And then there was like a slew of other emails that were like, "Oh yeah, she can do anything." So it's like that kind of environment, that kind of culture is what drives that empowerment of women. And I feel extremely blessed and grateful to be in a position to kind of help propel other women forward.
I would echo what Kasha says, and I would say, as one of the attendings who's been in the department the longest, Dr. Purim and I came over from residency together many, many years ago. I think the other thing that's really interesting is there's a lot of women in our department, and men in our department obviously too, who are doing all of these things in a lot of really different ways. Many of us have children, many of us don't. Many of us, you know, we've all kind of taken a different approach to how we manage juggling work and children and family and other obligations. And so I think that's something you see in the women faculty at Rush, but I think it's something you see in our faculty across the board, is that we have a lot of people who maybe did things in a less traditional straight path that you might find in some other academic institutions. For myself, my own career trajectory, I was 100% clinical for about 10 years. I was a night shift doc for most of those 10 years. And now I'm about 50% education between the clerkship and residency. And I'm the medical director of operations now, and I still work clinically. And when I work clinically, I work nights. And so that is just, Rush is kind of a place where when there are a lot of opportunities and they come along at different times, and there's always a sense within our department of, you know, being able to take advantage of those opportunities. So I think that's definitely one of our strengths.
So I'm gonna give a little bit of a perspective how during COVID, we actually realized that women physicians have sort of an increased stress and increased workload on them, interestingly, despite the fact that we are growing up in a very modern and not as traditional of a society as our parents were. And yet at the same time, what we learn, especially with little children or children who are early school ages, where somebody has to be in the house to sort of make sure that they're on their Zoom and on their webinars and etc. And so that workload at the same time was sort of taking away from their academic growth. And that was definitely a concern that was brought up on a bigger arena. And actually, as a vice chair, my role is faculty advancement. And so as part of my role, I need to make sure that women are not penalized for the fact that they have to do this increased workload and are continuously progressing and are truly delayed in their promotional tracks in academia because of this kind of increased workload. And it is amazing to see the work-life balance that is being difficult to achieve in this time frame, and yet our women are just so resilient and so unbelievably, I don't even know what the term would be, like workhorses and mothers and wives and partners, and at the same time outstanding clinicians. And I just can't even give enough shout out to all of the women in our department.
I would like to say, oh, go ahead.
One of the one of my proudest moments as a new program is when in our second class we matched 50% women. In emergency medicine, that's remarkable. So yes, I mean, you guys are great. Our senior class, 50-50. The applicant pool in emergency medicine does not look like that, right? It's about 35% women in the applicant pool in emergency medicine, and that's really tough. And that means that to be able to say this is a place that women residents feel that they can be part of this residency program, is a remarkable achievement. So I think that we're doing okay in that regard. We have not been able to reproduce that yet, despite trying to recruit as much as we can. But I do think that our role models help in that we have female leadership at all levels of the institution. Among other residency programs in the institution, female leadership is heavily represented. So I think this is an institutional thing, a program thing, and certainly a departmental focus.
I
I
do.
do want to point out that we are not discriminating against male candidates. That's not the point. I just want to make sure that you guys understand that we take qualified applicants.
And I would like to reiterate that Scott did as much as a father that any of us did as mothers, and then some.
I was actually going to say, as a male, I think our female representation, female leadership is amazing, and it's great to see. And as someone who plans our conference, I make it a point to always be cognizant to not have any males and to make sure that we are having all female representation whenever we can at the big regional conferences, and to really try to be an ally and promote our strong females as we can everywhere we can. And we even have local, kind of at our place, we have the women in emergency medicine. They meet kind of during lunch. I think it's monthly. And actually, like on the Chicagoland level, I think Shayna is on the board. And Dr. Hawk's also one of the founding members that are really involved in kind of women in emergency medicine, women in medicine in general.
That's right. From a resident standpoint, our attendings are amazing. They're these women that are strong, and we do have these monthly meetings. It's been a little delayed a little bit with COVID, but I think that's all life. But it's so empowering, and all these women are just intelligent and inspiring. And so I can say that from my perspective, I know I have a lot of like other friends from medical school where they can kind of feel that they're the minority with their gender. And I can say that I have never felt like that at Rush. And the fact that we have these meetings and it touches base on how just kind of some people can face discrimination and how to go above that and how to empower ourselves. And then also seeing that throughout the Chicagoland, which I think is one thing that also just should be mentioned. Like when you're with Rush, you're not just with Rush, you're with other hospitals in the Chicago area. And the emergency departments throughout this city are phenomenal with trying to get initiatives started. And so it's been a phenomenal experience in that regards. And so thank you to the women and men attendings, but thank you to the women attendings because you guys have been just great role models.
And yeah, you know, kind of just, we've talked a lot about what we're doing as Rush, but kind of just going back and taking a step back citywide, I think Chicago, there are like 10 EM residency programs within Chicago. And one of the things I love is a collaboration amongst all of these residency programs. From the program that Lauren and Dr. Scott had, Dr. Heinrich had kind of talked about, the Chicago Women in EM group. Dr. Hawk was one of the founding board members, and one of our residents, PGY3, Dr. Shayna Adams, is a new board member this year. And it's not just for Rush, it's residents in emergency medicine, faculty in emergency medicine across all the programs in Chicago. So I think that's an amazing collaborative effort. Also going back to the Illinois College of Emergency Physicians, we work with multiple residents and faculty from across the state in developing policies and educational reform and fighting for our programs and our patients. And even today, you know, we had our Windy City conference, which is like a citywide conference that all of the EM programs attend, and today's topic was a big one. It was protected, and we talked about all of our vulnerable patients that we treat and take care of in the emergency department, everyone from the homeless, LGBTQ, HIV, drug addiction, and kind of just seeing all of these amazing faculty and residents come together and talk about these really important topics is amazing. And I don't know of any other major metropolitan city that has that. Maybe I'm just because I'm in the Chicago bubble, but I think that just speaks volumes of how much we're realizing this within our own city and how much we're so motivated to change and provide better health care for all of our patients.
I think that's very well said, Kaya. That you know, if you're not from Chicago and all you do is watch television, you may get a sense that you know, why would you come to a city as with so much conflict and strife? And my perspective on this, being here, is why would you not? You know, if you want to make a difference in having an impact in these social determinants, this is the place to be. I came here for the diversity in our patients. And what we're really talking about is how can we create a group of physicians that looks as much as possible like the community that we take care of. We are one of the most diverse cities in the country. The place in which Rush physically exists is among the intersection of many different community groups that have very different experiences. We are about a third African American, a third Hispanic, a third Caucasian. We have a vibrant West African immigrant community. We have a lot of native Polish speakers. You know, it is a very cool place to practice. And whatever we can do, going back to the selection process for all of you, which is really what you want to know about, is I want to create a residency program that looks like that patient population, because we can only really teach each other how to best identify, empathize with, and be better carers for people that we may not have a lot of familiarity or contact with outside of our own, structures.
Awesome. Well, kind of ending up on the hour here. If anyone has any other burning questions that we kind of didn't get to touch on, feel free to go ahead and ask. If anyone has any closing comments, please go ahead. And again, just wanted to say thank you so much to everyone for coming out tonight. Really appreciate it. And I hope we were able to kind of give you a little bit more feel about our program and who we're looking for to bring into our residency.
Thanks, Kaya. Thanks, everybody, for being here. For those of you who've been along for all of these, thank you for participating. We'll try and get these up on the website so that you can take a look at some of our other past ones if you missed any.
And I'm just sharing this. These are the rest of our webinars that we still have. We'll be talking about wellness and then our mentorship, jobs, and fellowships. And hopefully we'll have some alumni come on for that one. And then the last session, we'll be finishing off with our social and community health, touching a little bit more about what we talked about today and specifically our social and global health track that we have and what we're doing with that. Yeah, if you have any questions, please feel free to reach out to us and follow us on Twitter, Instagram. I email all of you guys with these Zoom webinar links. If you want to email me, please go ahead. And thank you again, and hopefully everyone has a good night.
Thank you, everyone.
All right. Thanks, everybody. Thanks, Kaya. Great job.